If you're wondering what erectile dysfunction is, stay tuned because we're going to talk about some of the common causes as well as some treatment options for you. Hi, my name is Dr. Young Cho. I'm a board-certified plastic surgeon, and today we have a very exciting topic, erectile dysfunction, focusing on men. So what is erectile dysfunction? An erection occurs when blood flow goes into the penis, stays in the penis, maintains an erect shaft, and then allows you to perform sexual activities, and then the erection subsides. Erectile dysfunction is when there's an impairment of that process so that the penis either is unable to form an erection or the quality of the erection is just not where it used to be, and the duration of the erection is also compromised. So some of the different kinds of erectile dysfunction, probably the most common is vascular erectile dysfunction, and that is where there's an impairment of blood flow into the penis or the inability of the penis to hold that blood into the shaft while you are sexually active. Neurogenic erectile dysfunction is really when there's a disruption of the nervous system. This could be caused from things like cancer treatments, it could be caused by trauma, and anything other that may have stretched or injured that nervous system and disrupts that nervous pathway. Hormonal erectile dysfunction can also be just due to lack of things like testosterone, things that we slowly lose as we get older. Seeing someone and getting hormone replacement therapy in itself can make a contributing factor in improving your ED symptoms. Now, psychogenic erectile dysfunction is really due to stress or depression or anxiety or performance anxiety. The system works, but it's just something here that just creates the signal of, I don't know if I'm able to form an erection. It causes some anxiety and it's almost self-perpetuating. Sometimes it's really about what can we do to try to help with our mental health to build the confidence so that we're able to perform and form erections. For patients above the age of 50, it's not uncommon for half of the male population to be suffering from some form or some degree of erectile dysfunction. And it may mean that you're still able to perform, but it's just not quite the same as it used to be when you were younger. So those are all things, especially at the early stages, where there are some amazing treatment options available. With the most common forms of erectile dysfunction, with blood flow impairment being one of the biggest contributing factors, there are a number of things that we could be doing to help improve the blood flow into the penis and help it stay there during your sexual activities. Some of them include things like our P-shot, which is where we draw blood, spin it down, inject platelets back into the penile shaft. We could be using energy devices. There's acoustic shockwave therapy, which helps to build more blood flow into the penis. You can use Botox to help improve blood flow. So there's a number of options out there. And there's one treatment that may be so new that many of you may not have heard of it. If you're curious to know what this latest innovation is for erectile dysfunction, click here to learn more. And if you have any additional questions about erectile dysfunction, please leave them in the comments below. And certainly like our video and share this and subscribe to our channel.